Hi, everybody. Welcome back. Dentistry Beyond the Numbers. I'm Dr. Marc Liechtung, and thank you so much for making this a climbing, growing, expanding, received podcast with all the information I hope I'm giving out. People are telling me it's great stuff. They love my content. Got to share some great news with everybody that's been on my mind the last couple of days. I became a grandfather. My wife and I became grandparents for the very first time to an absolute gorgeous Mia Rowe Liechtung. Mia Rowe is what a beautiful name and what a beautiful young gal. And I look so forward to spending so much time with her in the future, spoiling the heck out of her. And can't wait because I raised three boys. So I've never had a girl in my life other than having girls in my life. And I never had a baby girl in my life. And I just can't wait till every aspect of her life. You know what? I can wait. I want to enjoy every minute because seeing that little baby, she's so precious. And one thing I will say, this is not part of dental podcasting, but seeing your children or seeing people you love and care for become caring and loving, it's a joy beyond. I think one of the joys of being a grandparent or being a parent is watching our kids take on roles that we've never thought they could. I'm going to make the analogy. It's sort of like what I do for Guardian Dentistry partners in our practices and practices around the country is make dentists better, make them grow in their hourly production. For lack of a better term, it's like young doctors that I'm raising and I see them grow and I see them really take on beautiful cases. I could just tell you in the same, just about the same day my granddaughter was born, and it was really an exceptional moment in my life. The associate in my Manhattan office, who's been with me a very long time and has really grasped the Super Generalist Concept, which is what we are going to pound today and talk about from a standpoint of, just I'm a believer of us doctors becoming super dentists. We can handle it. We could do it. We have the ability, the talent. So that day he turns to me and said, "Doc, take a look at the final result of Mr. Jones." And he says, "This was a full extraction case, bone grafting, temporary, all on X. Today we put the final in." I will tell you, one day I will share the x-rays with you. It is absolutely perfect. And the x-rays show perfect implant placement, perfect superstructure, just the off-angled screws, the whole case was done with such care, such perfection. And there's somebody who's been doing it for 5, 6, 7 years, consistently doing that all day long as implants and surgery. And he loves root canals, loves cosmetics, thus makes a super generalist. That to me is what we see the beauty and the virtues of what I do, the education from the growth of other doctors. I can't tell you what a joy it is to see doctors going. And we mention this all the time. You're not going to just tell a doctor produce dentistry. You've got to educate. You've got to understand. Something I've been seeing lately is the lack of understanding about comprehensive dental care. And what I mean about that is comprehensive dental treatment planning. When I go to a physician, I want to know what's wrong with me. I don't want them to determine what is wrong, what they want to let me know, and what they're going to go and address. That's not what I'm going to my doctor for. I'm telling my doctor, I want to know if I'm healthy. Please tell me how I look, what's going on, do a body scan, do a body search, do whatever you got to do. But I want to know, how do I look going forward? And I feel the same compassion, the same need that we have as dentists. And I've said this a number of times already. As comprehensive dentists, we cannot hold back what is wrong. But the way we phrase the treatment planning, the way we phrase the sequence of case presentation makes all the difference in the world. And that's something that we're going to dive into in the future. I went to University of Pennsylvania Dental School, and at UPenn, they talk about, like many dental schools around the country, we talk about phase 1, phase 2 treatment. If somebody comes in to fix their front of the mouth and they have rampant gum disease, rampant decay, need a few teeth out, we are not going to fix their front of the mouth unless we fix the disease. And that is the angle, the issue that I present. No an angle, it's just transparency. Mary, you have excessive amount of decay. You have teeth that may need to come out. Before we address your smile and your beautiful smile line, that's going to be a magnificent outcome, we want to get you healthy. So when we talk about health, that's phase 1, right? We want to get them healthy. So we don't want to overbear them with everything, but what we need to do is get healthy. Then we can also mention that you need 8 laminates, 2 implants, 2 crowns, and a few onlays. And that will be after we get you healthy. Oh, doctor, great. Shows many things, and we're going to get into that. It shows that you are caring about the disease that is in one's patient's mouth. It shows that you have the knowledge to sequence the cases so you're not lost. You're not looking at something and going, oh my God, because no patient wants to hear, oh my God, right? You have it down. You know what you're tackling, quadrant by quadrant. You're going to see the hygienist for 2 visits. As you get numb for those visits, we are going to bring you into my operatory and we are going to treat those numbed quadrants as best as we can. So I said this before, and what I'm learning is comprehensive dental treatment planning means a lot to a lot of people. But to me, it only means one thing. It means explaining to the patients, getting them to commit, and then having them make a deposit or some sort of financial commitment to the practice. So there are a couple of phrases that I use. Phrase number 1 is exceptionally important to me, and I've never heard it used, but I use it. I use it every day, all the time in my practices, and in my podcasts, and that is, we aim to do 2 things in the scope of treatment planning. We aim to give the patient a perceived value. Now oh yeah, of course, I'll tell them what they need. No. It's not just saying, oh, you need 2 cavities filled here, you need a crown, and you're going to need a night guard. Okay? No. You've got to give them the perceived value. We talked about this before. That 30 to 60 second why you need the crown, why we should do a crown other than a filling. Why, Mary, should we take this tooth out? Not we're going to take this tooth out, not standing over the patient. We give them the perceived value that we are going to get you healthy, and then we're going to give you a beautiful smile, or we're going to get you healthy, and then we're going to give you maintenance as we go along with the hygienist. And remember, the hygienist doesn't have the hygienist. It's Sarah. It's Michelle. Those are the people, right? You want to call your hygienist by their first name so it's part of the family. I don't care if she's a 1-week-old hygienist. Then I'm going to let you, Mary, I'm going to have you see Sarah for the deep cleaning. She's wonderful. Okay. Like when you put a name, the patients are starting to feel secure. What does that mean? It's perceived value. This doctor cares. This practice is all about me. But what's the next thing we can do? We need to worry about and remember, not necessarily worry about, I'm here to help you worry less, right? By education, but by understanding that every treatment plan needs a commitment to dentistry. So there's a perceived value and there's a commitment to dentistry. Our job, doctors, is to give that patient the most perceived value we can. What does that mean, perceived value? Somebody walks in and go, yeah, I know you're going to tell me. I heard it all the time. Well, I got a whole sequence we're going to review. Starts with the pan. All of a sudden, you're telling, remember I said, we're going to check the angle of the mandible, tell the patient there is no cancerous lesions. Nobody said that to me. Perceived value. Look at the angle and the bone level. Really good, really beautiful level of bone. It's like a teenager. Really. Perceived value. What we are trying to do in the first 10 to 15 minutes of our examination is give our patients the confidence that they're with the right doctor in the right office with the right team at the right time. That's what we're doing. That's perception or perceived value. So if you remember one of the casts back before, and we're going to get into it even in depth because we're going to talk about that, is what I look to do, right, by giving that perceived value is broke it down to 4 steps. The Panorex, which we're going to talk about. We're going to bring up a Panorex right, and we're going to talk about how we can make that, again, such little hints that make a patient go like this, like that. And all of a sudden, your patient is leaning back. You could tell by the body language. They're asking questions like, will it hurt? They're not asking questions like, how much? How many times do I have to come? They're asking, can we get it done soon? That's when you know you've done your job. I gauge my treatment planning really by the questions the patient asks. Doc, so this is going to cost a lot, right? Well, let's see what this is. I want to take a look, and we go through everything, and we say, all right, doc, yeah, it's going to be tough. Well, let me show you this. Do you see this hole here? This is what you're feeling sometimes. You think it's from the top. It's really from the bottom, really. And the one you thought needs to be fixed, I don't think we need to fix that right now. We can keep a watch on it. Wow, that's great. Perceive value. When we tell them little tidbits, bone level, old infection healing, no problem, like a scar tissue, any little tidbit that you might think is trivial, it's not trivial to the layman. What it is building perceived value. So the first step is tell the patient what they need. Now, that's not just rattling off a grocery list. That's rattling off in your mind what they need. But when you present it, remember, we are actors and actresses. So when we present this, it has to sound like we care. We're empathetic because we are. We're happy we have an opportunity to do all this work. But we're not going to go, great job. We're going to, Mary, we got 8 crowns, 3 root canals, do it. We're going to go, Mary, unfortunately, you need some work. And we want to get it now before it gets really bad. So, first step, tell them what they need. Second step, tell them what happens if they don't do it. The grumpy guy who's sitting there like this, waiting to hear, right? He's usually jowly, sitting there. You're saying, well, John, you're going to need a few crowns. And if we don't do those crowns now, yeah, I know it's going to cost a lot of money, right? No, it's going to cost what it'll cost. But what I'm trying to do is not have you lose those teeth, get implants, or need root canals. Doc, I don't want root canals. This is why I'm telling you, you need these crowns done. If you don't do it within the next several months, I never predict, several months, you're going to need root canals, or worse, you're going to break the teeth, you're going to lose the teeth, you may need implants. Doc, I don't want implants. Then what I'm saying to you is these crowns will definitely do the trick and help you a lot and take care of the issue. Well, that's great. All of a sudden, body language, he's not protective anymore. He's now looking at you with respect. So you just told him what he needs. You're telling that patient or any patient what happens if they don't do number 1. What happens at number 2? Number 2 is, right, you can get an infection. You need a root canal. I said this before. We'll say it over and over. The beauty of dentistry is we have the ability to put in front of our patients what happens if they don't treat the teeth. What happens? You lose it. You need an extraction. You need implants. You need a bridge. You need a denture. I don't want a denture. Well, do the case. Save your teeth. We can get you financed. We'll get into that. The third thing is we tell them what it entails. John, I know you're very skeptical. I know you've been through a couple of dentists and you're a little apprehensive. But I could tell you that what we're going to do is we're going to get you numb like you do a filling. And we're going to make sure you don't feel a thing. And then it's going to be about 10 to 12 minutes, probably less of drilling, maybe even less. Just want to make sure it's all cleaned out, maybe 8 to 10 minutes of drilling for all the teeth. We're going to fix the teeth. It's going to be very simple. You're going to walk out of here with temporaries. They're going to look great. You're going to feel great. There's going to be a perfect, non-complicated procedure. If it is going to be a complicated procedure, you tell the patient, we're going to do everything we can to avoid the root canals, avoid any more damage, avoid any more work, but we need to do definitive treatment. And that's what we're going to do. Or if a patient has been a patient of mine for a while, I say, Mary, you remember that filling we did a few months ago? Sure, doctor. It's going to be the same injection. It's the same, right? It's the same block or the same local anesthetic that we use on the maxilla. If we're going to do an MOD, a crown, and for argument's sake, even a root canal or extraction, we're going to get them numb. And we're going to make sure they're profoundly numb, but it's the same avenue of administering the anesthesia. Wow, doc. The fourth thing is we get up, as good as we are and as comprehensive as we might be. We get up and say, Mary, Debbie from the front is going to come in the back and she is going to give you the numbers and the treatment plan and work everything out so it's to your satisfaction. It'll be fine. But doc, tell me how much. That's way over me. Let them deal with this. This is what they do. I fix teeth, Mary. I want to fix your teeth to the best of my ability. But let Debbie come in and talk to your numbers. Okay. 4 things. Treatment plan. 1, tell the patient what they need. 2, tell the patient what happens if they don't do it. It's a simple playbook. 3, tell them how easy it is. 4, get up and get the treatment coordinator. I said this last time, and I want to dive in for a few minutes about the treatment coordinator. The treatment coordinator's job is to come in and do the final of the two verses. Perception of value, perceived value was given. Doctor did a great job. Led that patient right to the water. That Debbie, that front desk coordinator, you people up front, male or female, you're coming back there. You're going to be doing the closing of this treatment plan, no matter if it's $5, $10, $50, $80,000. It's very important that there is no emotion when we talk money, because doctors, we have an emotional tie to these patients. So that's why we don't want to talk numbers to these patients. We want to talk teeth, healing, work, treatment, post-op sensitivity or lack thereof, and then get out of the room. Let Debbie and everyone else like her come in and close that case and commit to patients to dentistry. What does that mean? It doesn't mean making an appointment. It doesn't mean saying, we're going to take 3 hours next Tuesday and we'll book it out. Bye, Mary. See you then. No. It means presenting a treatment plan for $48,000. And Mary's going to go, whoa, well, Mary, there's a lot of work done. But remember, there's phase 1 and phase 2. Phase 1 is about $8,000, Mary. We're going to do some extractions, a cleanup by Sarah, the hygienist. We're going to get your gums all healthy, all the decays out, the bad teeth are out. And then phase 2 is the final phase. We're going to replace the teeth and make you smile and your bite perfect. Wow, that's awesome. So right now I want to make an appointment to start the process of getting you healthy. So we have a few choices. I'm not going to make or pretend to be a treatment coordinator, but the way I look for it in my practice, because I believe the term super generalist is if you're able to put implants in, do cosmetic veneers, crown and bridge, adjusting bites, putting people in centric. If you're able to treatment plan cases like I'm describing, you are able to run your business, or at least know what you demand of your business. And I demand of my business that we have 3 ways of getting this done. 1 is the patient pays in full. 2, the patient pays for phase 1. Or 3, the patient puts down a deposit for the entire case. I know we're not going to have any missed appointments. We're not going to have any confusion. Through my career and my experience, the number 1 reason that a patient leaves a practice is not because they got hurt, not because the wrong tooth was done, not because they didn't like the shade. It was financial. Take the finances out. Get a treatment coordinator in your practice that could make that commitment to dentistry in one of those 3 ways. You want that patient coming in the next visit and not worrying about anything, just worrying about how they're going to feel after and making sure that the doctor's going to treat them right and they know they're going to be in good hands. That's it. If they come back the next time and they have to talk money, I believe 40% of those patients don't show. I grew up, I practiced, I raised my family in a city that had a dentist all over in New York City. I know you might not be able to tell I'm from New York. I always say this because of my accent, but I try hard to keep it there. But in all kidding aside, that is the most amazing thing to me, is that there are dentists all over the city. And I always practice, and I tell this to my associates, like my patients are going out and getting a second opinion. What avoids them from getting a second opinion? What discourages them from getting a second opinion? It's very discouraging when you already put down a deposit or paid in full. You don't even think about getting a second opinion because the perceived value was so great and the handoff to the commitment was so smooth. This is the way a business of dentistry should run. This keeps your book vibrant. This keeps your treatment planning extensive, and this keeps the production and the collection at capacity. And that's what we look for. So I wanted to bring that up because I'm hearing a lot of people talk to me about that. A lot of people making comments that they thought, though they think commitment to dentistry is the treatment coordinator presents the case, makes an appointment, and says, bring in $11,000 next time. They're not bringing in $11,000 next time. They're going to find somebody where they have to bring in six, and it's a little less expensive. And if they go to another dentist and said, the treatment plan he gave me was for 48, can you do better? The doctor's going to say, yes, I could do it for 42. Done. That's not commitment or perception. We did not do our job. We have to commit them. And then there are patients, and then they go in the book. Our book is our lifeline. We don't put things in there unless they're committed and ready to go. So I wanted to run that by everybody for a few minutes, just to give you an update of what is talked about in some of my chats and some of the people that have responded to me. And please like me on all the major Spotify, Instagram, Facebook, and of course, LinkedIn. Please like me or comment or just follow me, because there's going to be some exciting things. And talking about exciting things, with the addition of a granddaughter, the month of August coming, which is my birthday, and I've decided to take a pause for a couple of weeks and rest my body, rest my mind, but more importantly, spend some time with Mia Rowe, and spend some time with the family. I don't want to put out half-baked episodes from a poolside or from going somewhere. So we're going to take a couple of weeks. It's going to be 3 weeks that we're going to post our next podcast. And I did want to get into some of the things I've been seeing out there and then understand why I'm doing this. Okay. Somebody asked me, what do you want to do? I love to educate. I believe that if you make money and you're doing quality work, not in that order, you're going to love what you do. And they say, if you love what you do, you never worked a day in your life. And I see and I hear many dentists, people used to say, we know about dentistry and suicide and all that crap. I'm not a believer. I think that comes from just mental illness, but that's not for me to discuss. I think that I really believe, in my experience, I haven't met many dentists that walk around hating dentistry if they made dentistry not only a phenomenal profession, but a great business. And for that, my commitment to my podcast of Dentistry Beyond the Numbers is not marketing. What I'm going to do is present to you what I believe is the best avenue and pathway to being a super general dentist. And in my opinion, in the next 20 to 25 years of dentistry, it's all going to be about the super general dentist. It's all going to be about the general dentist, the gatekeeper. How high and how much do they want to do? Are you a wonderkin? Are you somebody who really loves surgery, loves cosmetics, wants to do it all, loves crown and bridge? Why not? The vendors out there are training us. There's so many avenues of learning how to do it. So why not do it? That's what I want to bring you. What I started this podcast with was my dental hand, my dental hamsa. Why? Because I'm about making the dentist great. I think making the dentist great encompasses everything in the practice that we need to know to look for in order for us to be a very, very successful practice, a very successful doctor. Like the dental hamsa says, like we learned, we went through it before, it's clear aligners, root canal therapy, crown and bridge cosmetics, surgical extraction and bone grafting, and implant placement. To me, that's a procedure hand. That is an armamentarium of procedures that a dentist, if you can master those, you are what we call a super generalist. But I believe there's more to it. We just touched on comprehensive treatment planning, right? Financial understanding. We are going to dive into these things, but not by me alone, because we talked about Dr. Vibata. Practice efficiency, financial sustainability, work-life balance, and a great exit. So what I want to do is, this is a learning center for dentists that want to be great. What is great? Go from $253, $350 an hour to $1,200, $1,300, $1,400 an hour of production. Think about that. Every day you walk in, you're producing between $1,500 and $2,000. You're producing between 12 and 15, sometimes 20,000 because you can do all these procedures. What we're going to do after our short pause of a few weeks is we're going to line up some of the best of the best. Clear aligners. I don't want somebody who does clear aligners. I want somebody who invented and understands the concept, but also understands the meaning of bringing clear aligners into our practices and how much that grows our perio, our cosmetics, our crown and bridge, and dare I say implants, clear aligners, moving teeth. And subsequently, as I always say, dentistry begets dentistry. Root canal therapy. Sending root canals out, and I'm talking premolars, anteriors, and even molars, is a crime. It's a crown without a lab bill. We must have the understanding of why we bring it into the office, why we want to be proficient, and the different calibers of percentages that it'll mean to our growing business. Crown and bridge cosmetics. I don't want to. I've been contacted by one of the best cosmetic guys in the country. He goes, Marc, I want to just get on your wagon, boy. He goes, man, I want to be with you. I want to educate your listeners, and I want him to, because the pearls that he'll bring to a cosmetic case is unbounding. Surgical extractions and bone grafting. Think about that emergency that walked in and needs 2 molars extracted. And you're just saying, I don't know. But if you were trained, if you knew what it meant, if you had an understanding of the next step with a graft, that's not only of $1,500 to, could be $1,500 of revenue. It's also leading to the next, the implant placement, fastest growing procedure in dentistry by a lot. These are the things we want to expound on. So when we start up next time, we're going to bring pillars of our industry to explain why doing this in your practice. I'm not just saying bring in a specialist. No, I'm saying within us, when you have young docs that are are begging for education, they want to be this chamsa. They want to incorporate great dentistry. They don't want our patients going cross town, uptown, through town, across the hall, not control. We could do it, and we could do it as well and as proficient as others. Somebody said to me, why would I go to a doctor like yours if I could go to a specialist? Great question. If you're a specialist patient, you're going to want to go to a specialist. But if the patient and the doctor meet and the doctor gives perceived value, trust me, that patient will commit to dentistry in your practice with you. And I'm not saying we as doctors should do every single thing. There is a need for difficult cases, torturous roots, calcified roots, but straight up molars, 3-4 canals, I don't think that should be a problem today. And we're going to go into it and know why. We're then going to deal with the bottom of the hand. We're going to deal with financial understanding. I want to bring in some real great operators, not dentists, dental practice operations people, and understand their numbers and what do they look for and how do they grow their practices. How do they look at what percentages should be what and how to work on it? Let's pick the brains of the great ones. Through my experience, I'm going to bring you those. And my goal is to educate you to develop an unbelievable efficient practice, unreal financial sustainability at the hourly rate and the quality. We're not redoing dentistry. We just keep growing. And that's the goal. Redos kill. Remakes are not acceptable. We all have a percentage. Somebody breaks it, some miss. But at this point, when you grow and you learn, you should have a tremendous work-life balance. You should have a tremendous work-life balance. You would love to come to work because you're doing the things you love, and you love to go home and do whatever you want to do. Because tomorrow, the way you have it situated, we're going to go at it again. It's no longer what I call the crapshoot. What's today like? 3 cancellations, 2 new patients may show. That's the crapshoot. What does it look today? Oh, you got 2 crowns in the morning, an implant. You got a root canal midday, emergency coming in. Mary Smith says she broke a tooth. You got 2 implants in the afternoon. You got a big case that you're inserting. What a day. That's every day. That's 15 grand every day. So those are the things, because as we grow and we get older or we get the itch, we have a great exit. I call it a fantastic exit. So we're going to dive into these things in a few weeks. We're going to have it lined up. It's going to be great. I'm the guy who wants to train you, the dentist, and you, the team, to become great, to become the best practice you could be by delivering the best dentistry, giving the most perceived value, and committing over 9 out of 10 patients in your treatment plan committed to your practice. This is what we're going to do. This is how it's all tied in. The one thing I do love about dentistry, and I say it a lot, is it's just an organism. You have the front, you have the middle, and you have the back. We have the front, which is booking and getting those patients committed. We have the middle, which is the billing and understanding the runnings of the office. And we have the back. And the back is all the treatment, the staff, the team that works well together like a machine. Of course, the hygiene is absolutely paramount. That's what we're going to get into on our next stance of Dentistry Beyond the Numbers. I'm always available to chat. I get a lot of requests these days. It's kind of exciting to talk and speak about things and really give some questions like I addressed today. I think it's a very important aspect to not misunderstand, but to really understand we have the ability to stop standing over our patients and make our patients feel like they're part of the family. It takes a minute longer to give that patient that perceived value, but you keep that patient forever once they're committed. That's what I have for you today. I think it's pretty darn good stuff that we have to embark on. It's really the guts of dentistry. So I really hope you join me in the next phase of Dentistry Beyond the Numbers. We're going to rip apart the Hamsa. We're going to understand our value, and we're going to soar like eagles in our practices. Thank you so much. This is Dr. Marc Liechtung. This is Dentistry Beyond the Numbers. I'm a new granddad. I'm excited, but more important for now, I will see you next time. Well rested, excited, ready to go on Dentistry Beyond the Numbers